Cervical cancer is a form of cancer amongst women, and it is the most commonest cancer. The first one is breast cancer, followed by cervical cancer amongst women. It occurs from the cervix, which is part of the uterus, the uterine womb of the woman, the lower part. In Pidgin, we say neck block bilum do baby. Yeah. So this is exactly the site where cervical cancer develops from. And it is caused by, now that the recent science has come about to identify that the risk factor is a virus called the human papillomavirus. Yes. So cervical cancer, basically, if you'd like me to put it in simple terms, is cancer of the womb. So studies have also shown that it is quite common that almost 100 to 1,000 women die every year from this disease, close to a rough estimate of about 650 deaths from cervical cancer every year. And the newly diagnosed ones, they are also around the same number of cervical cancer. Yeah. So it's quite common. And if you go into a ward, the gynecology ward, you would see one full ward is just dedicated to patients suffering from this condition alone. Human papillomavirus is a sexually transmitted infection similar to gonorrhea, chlamydia, HIV. So sexually transmitted, and it can come and live in a woman for up to 10, 20 years. If she is immunosuppressed by, maybe she's got other conditions like diabetes or HIV, then it brings that time frame shorter, so the woman develops the disease process faster. So what the human papillomavirus does is, because it's a DNA virus like HIV, it eventually goes in to destroy the cells around, the normal cells around the cervix. So that is the human papillomavirus and how it leads on to cause cervical cancer. So if we can just look at preventing the infection primarily from getting to a woman, then we should eliminate cervical cancer at the end of the day too. And looking at our prevalence of STI in the country now, there are lots of talks about HIV going past the 1% prevalence rate, which means that other STIs are also increased in the community and population, and also gives increased rate of HPV as well, because they all cluster under sexually transmitted infections. Yeah. If a woman has a HPV infection, she doesn't show any symptoms. She's just walking around normal. Nothing at all happens. And that is the thing, that we think like we are healthy and we do not have this, but we carry that risk factor with us. The only way to know that we have HPV is when we do a test for HPV screening test, cervical cancer screening test. Eventually, it goes on to develop cervical cancer. It starts from a precancerous lesion, which means it's not cancerous at this time. So HPV, precancerous. Again, the woman doesn't show much of the symptoms. Maybe she has a few discharges and lower abdominal pain, and eventually develops into stages of cancer now, where you have 1 up to 4. Stage 1, the woman has a small growth just there on the cervix, less than 2 centimeters, and she might bleed in between a menstrual period or after intercourse, or chronically having discharges that are not treated with antibiotics. And later on, from that small lesion, it goes on to involve the whole cervix, and now the woman has more severe complications, maybe chronically bleeding now, a lower abdominal pain, discharges are persistently present all the time. and pain may be from the front to the back as well. So that's stage 2. Stage 3 and 4 are more complex with other organs involved at this time, like the bladder, the rectum as well. And it descends on to stage 4, which affects the lung, the liver, and the other parts of the body as well. The screening test has changed over time with the agency of identifying the causative agent sooner and then treating it maybe on the spot. So before it was pap smear. Pap smear, layman's term, is just a burglar coming into your house and breaking the glass down of your window. We don't know who is causing that. With HPV, now we can identify who the culprit is. So again, HPV, there are 100 different subtypes of HPV. Some just cause little warts around the perineum, and some cause some ulcers around the mouth and all that. The ones that we are really concerned about is the type 16 and 18. Yeah. So pap smear, it has been done away with, and now the test recommended worldwide is the HPV screening test. It's a DNA test, so if your test comes back negative, you get to have it repeated after 5 years. Before pap smear, they'll recommend for you to come every 2 years to do the tests. Yeah. So that's the evolution of HPV cervical cancer screening, going more towards HPV screening at this time. That's a big challenge for women. Now people are getting more educated with the social media, internet access, and they want to have these services given to them. But the thing is, with only one obstetrician working in a provincial hospital looking after a population of, I would say, maybe 300,000 women, that's a lot of work for that particular person to do, screening alone. So we have to now have accessibility in terms of having these services provided to the woman. Maybe in the village, when she comes to the market and this service is available, you can do a test and get the result at the time, same time. So we are still not there. Now women who want to do this test, they have to go to centers where it's provided, like in Medellin, in Hagen, Goroka, come to Mosby. In Mosby, this test is provided in a lot of private pathology labs, hospitals, and the one at Badili as well, by CPL. Yeah. So accessibility is a challenge for most of the population of our women outside who have no access to, these facilities and healthcare. The only cancer treatment we have at the moment is Engao at this time. So it's not only treating cervical cancer, it's treating all other cancers as well. So before the woman even goes and starts the treatment plan, she has to have the diagnosis made known to her. If she does the HPV test and the test is positive, it doesn't mean that she has cervical cancer. It's just positive. So maybe she's got type 16 or 18 positive. So now the doctor or the health worker needs to test to see if there's already a precancerous lesion there. So we burn it off with a thermocoagulator. Yeah. After 6 months, she comes back. We do a repeat test. If it's there, we do the same procedure again for her. If it's absent and it's gone now, good. You come back after 2 years and get another test done. And we do a follow-up, regular follow-up. If she goes through the HPV, the test is positive, and there's obvious lesion now, the doctor will need to confirm that with a biopsy, where the tissue is provided to the lab. And, if She was living outside and she had to get it through to her pathology lab. It might take her 6 months to a year before she gets the histology report. By that time, the disease is not waiting for us. No, it's just progressing on like that. Yeah. If she comes to Mosby where she has access to maybe PIH, Paradise, 2K Medical, any other pathology labs here, then she might get a result within 3 weeks. And that 3 weeks is important for the doctor and for herself as well. So she gets the biopsy result. The doctor sees it. The doctor now classifies what classification she is now. Yeah, there's a stage where the doctor can operate. There's a stage where the doctor will not operate. So 2A is the cutoff for the doctor to operate. So if she gets the operation, after the operation, she'll go through to get a CT scan to see if there's spread, or even before the operation, she can also get a CT scan if the diagnosis is made by histology report. All right? So from there, after the operation, the doctor then refers her to Engao for her care there. At Engao, she can stay there for 6 months to a year just to go through the process of chemotherapy and radiotherapy. Yeah. So it's a lengthy process, but the first step is getting the test done and confirming the diagnosis. So HPV vaccine is the primary prevention method, where like the BCG babies get to prevent TB, HPV vaccine is just like that, primary prevention. So the age category is from 9 to, now it has increased up to 20 or 19 to 20 years, so they can get it. The aim is before a sexual debut, the girl must get that. So 3 shots, 6 months apart, yeah, they get that immunization. It's provided we have it at Paradise. It's quite an expensive vaccine, so it's quite expensive. If you're interested, you can find out from our BD team, whoever is listening. But we've had girls coming in to get that vaccine. And they are okay, they are healthy, they're moving around. And the girls who are coming are because their mother has gone through some of these processes and diagnoses, and they don't want their daughters to face the same thing. You know, in countries like Australia, they've fully vaccinated all the schoolgirls. Now they're vaccinating boys as well. So their cervical cancer rate has drastically dropped down. So the way, because of maybe our beliefs and all these thoughts about probably the COVID as well, had some impact on the vaccine. So it's the primary prevention. If you have a daughter who is in that age category, and knowing now that cervical cancer is killing women, before it was, affecting women in their 50s. Now you walk through hospital beds, and recently I was in Buka and I saw this 28-year-old young lady in advanced disease, and it's really saddening, to see that. So if you have daughters and you're worried about their future, please let them have this vaccine done, given to them. My daughter has received 3 vaccines already. She's okay. She's in the university now. So I'm encouraging young girls to come in for this very important vaccination. The PNG ONG Society, which I'm a member of, is working on a cervical cancer program. It's been a work in progress over some time now, but it would be really good to see that HPV screening program is brought down to all the provincial hospitals, and just like what Haba, that's one at Badili, is doing. it's subsidizing all the way to 20 kina when this test is quite expensive to get as well, So if provincial health authorities under the National Department of Health have these services subsidized for women to access it, I think it would be really great. Knowing that the STI prevalence is very high, HPV2 is about 43% around there, the HPV alone, and for the high risk group of 16 and 18, it's about 13%. It's quite high. So we'd be expecting a lot of this to be positive amongst women, even the women living in the village as well. Now there's road accessibility, so many activities happening, so they need to be tested as well on this. So having these services accessible to the women in the village, then we would be really doing a great job, yeah. And also subsidizing the HPV vaccine for young girls. That's another area where the National Department of Health should look at and try to, give something back to the people by doing a subsidy on this 2 screening program. From a personal point of view, a lot of women, they are scared. They are scared to, get the answer like, you have HPV or you have cervical cancer. That just frightens a lot of women, and it comes down to maybe not enough health education being given to them on this. We don't have excuse of not understanding what are common things happening to our lives like cervical cancer, breast cancer, because we have smartphones, we can read up ourselves. Don't be afraid. The earlier you do this test, the more you get yourself, your status known. It helps you to plan for your future as well. We are seeing a lot of young ladies in their 20s, 30s dying, and these are the young population that should be working and supporting the government, looking after their children. They're leaving behind 9, 10, maybe 8, 5-year-old children without a mother. So we don't want to leave our children alone without a mom. So come in and do your test. Know your status. Have a positive thought and thinking like, if this test comes back positive, I know I will get help. Because I shared a story about Lalita. Lalita came in, she only has 2 children. So the youngest is 8 years old now. And the big boy is about 10, 11 years old. As she's walking, she went to get a chemotherapy, radiotherapy. Now she's back moving around. You won't see her like a patient with cervical cancer because she made a bold decision and the husband supported her. Like, let's get this sorted out. Let's do this. Let's follow the doctor's advice. And now she's healthy and living with the boys. So don't be afraid to do this test. Just come forward and get this test done. It's going to save your life, actually.